Preventing Hip Dysplasia in Labrador Retrievers, a guide to responsible breeding, diet, exercise, and weight management. Labrador Retriever Hip Dysplasia. Prevention hip dysplasia is a common orthopedic condition that affects many dog breeds, including Labrador Retrievers. It is a debilitating condition that causes pain, limping, and difficulty in walking. Understanding the causes and preventive measures for hip dysplasia in Labrador Retrievers is crucial for the well-being and quality of life of these beloved pets. What is hip dysplasia? Hip dysplasia is a condition where the hip joint does not develop properly, resulting in the ball and socket joint not fitting together correctly. This leads to joint instability, cartilage damage, and eventually, arthritis. It is a genetic condition, meaning it is passed down from parent dogs to their offspring. However, environmental factors such as diet, exercise, and weight can also contribute to the development and severity of hip dysplasia. Labrador Retrievers and hip dysplasia. Labrador Retrievers are one of the most popular dog breeds around the world, known for their friendly and energetic nature. Unfortunately, they are also prone to hip dysplasia. According to the Orthopedic Foundation for Animals, OFA, Labrador Retrievers have a high prevalence of hip dysplasia, with 137% of dogs tested being affected by it. Causes of hip dysplasia. As mentioned earlier, hip dysplasia is primarily a genetic condition. Breeding dogs with hip dysplasia increases the likelihood of their offspring developing it as well. Therefore, it is essential for breeders to screen their breeding stock for hip dysplasia and only breed dogs with excellent hip scores. Additionally, environmental factors can also influence the development and progression of hip dysplasia in Labrador Retrievers. Overfeeding puppies, rapid growth, and excessive exercise at a young age can put stress on their developing joints, leading to an increased risk of hip dysplasia. It is crucial to provide controlled exercise, a balanced diet, and avoid excessive weight gain during a Labrador Retriever's growth period. Preventing hip dysplasia in Labrador Retrievers. While hip dysplasia is a genetic condition, there are certain preventive measures that can be taken to reduce the risk and severity of the disease in Labrador Retrievers. 1. Responsible breeding. Choose a reputable breeder who screens their breeding stock for hip dysplasia. Ask for hip and elbow scores and ensure the dogs have been certified by organizations such as the OFA or the British Veterinary Association, BVA. Breeding dogs with good hip scores significantly reduces the chances of their offspring developing hip dysplasia. 2. Diet and nutrition. Feeding a balanced diet is essential for the overall health and well-being of Labrador Retrievers. During their growth phase, it is crucial to prevent rapid weight gain, which can put additional stress on their developing joints. Consult with a veterinarian to determine the appropriate diet and portion sizes for your Labrador Retriever at each life stage. 3. Controlled exercise. While regular exercise is important for Labrador Retrievers, it is crucial to avoid excessive jumping, running on hard surfaces, and strenuous activities that put undue stress on the hip joints. Walking, swimming, and controlled play on softer surfaces are recommended to build muscle strength and maintain joint health. For weight management, maintaining a healthy weight is crucial in preventing hip dysplasia. Labrador Retrievers are known to have a hearty appetite, so it is essential to monitor their food intake and provide a balanced diet that meets their nutritional needs without causing excessive weight gain. Regular exercise also aids in weight management. 5. Joint supplements. Consult with a veterinarian about the use of joint supplements, such as glucosamine and chondroitin, which can promote joint health and support cartilage development. These supplements can help reduce inflammation and alleviate symptoms associated with hip dysplasia. Conclusion. Hip dysplasia is a common condition in Labrador Retrievers, but with responsible breeding practices and proper care, its risk and severity can be reduced. Choosing a reputable breeder, providing a balanced diet, controlled exercise, weight management, and considering joint supplements are all essential steps in preventing and managing hip dysplasia. By taking these preventive measures, we can ensure that our Labrador Retrievers lead happy, active lives, free from the discomfort of hip dysplasia.